Hello, my name is Crystal Johnston, and I am an LPN to BSN nursing student at Indiana State University, and I will be presenting my health education project for community health nursing. The title of this presentation is Universal Birth Control, and I will be discussing how contraception affects a certain population at risk, which is sexually active adolescents in the community. The learning objectives for this presentation are that the audience will describe the impact access to birth control has on the population at risk. The audience will list the types of birth control utilized and describe the cost benefits of birth control. The audience will demonstrate understanding of the ethical dilemmas of universal birth control. The audience will advocate for ethical and culturally sensitive solutions to accessing birth control. The audience will list resources to find more information. Before I begin the presentation, I have included a short pre-test for you to complete. Please pause this video presentation and click the link below. There is also a link to a handout to use when following along. What impact does birth control have on society? According to the CDC, the infant mortality rate has declined 70% since 1970, and the national teen birth rate has declined almost 70%. The teen birth rate is currently at an all-time low. According to the World Health Organization, birth control prevented 308 million unwanted pregnancies in 2017 alone, and 15 million adolescents use birth control. An estimated 23 million adolescents are without access to birth control, and therefore at a higher risk for teen pregnancy. Current research shows that birth control improves economic conditions, maternal and child health, education, and human rights in general. Birth control also reduces abortion, especially unsafe abortions, decreases the maternal mortality rate, which is significant because an estimated 2 out of every 3 pregnancy-related deaths were deemed preventable. There are many different types of birth control. There are various birth control implants, IUDs, birth control shots, vaginal rings, birth control patches, birth control pills, which is one of the most used form of birth control, condoms, internal condoms, diaphragms, birth control sponges, cervical caps, spermicide, and surgical interventions such as vasectomy and tubal ligation. So there are many birth control options to choose from depending on the individual situation and preference. What are the cost benefits of birth control? According to the United Nations, every $1 spent on birth control saves $2 to $6 from reducing the needs of public services. Birth control lowers fertility rates, which lowers the ratio of dependents to income earners and results in national savings. According to the CDC, the declining teen birth rate saved $4.4 billion in 2015 alone. The Affordable Care Act requires health insurance plans include some birth control coverage, and there are some government programs to provide free birth control to those who qualify. This often applies to adolescents. On average, birth control can cost up to $50 per month. There are ethical dilemmas involved with birth control, especially in regards to adolescents. One ethical dilemma is adolescent confidentiality. The provider may be in a tough situation when keeping health information confidential if that is in conflict with the parent's wishes. Whether or not parental consent is needed can be an ethical dilemma because sometimes it's not clear whether or not an adolescent is mature enough to make decisions independent of the parents. There can be legal barriers that present as ethical dilemmas. For example, Some states allow adolescents 12 to 14 years old to consent to birth control, and some states require parental consent. Insurance coverage and costs can be a dilemma because these can limit access and exclude certain populations, specifically those of low socioeconomic status. And gender bias is an ethical dilemma with birth control because birth control education and tools are focused on females, who are the most affected by unwanted pregnancies, but tends to neglect males. Cultural considerations and awareness of personal biases are really important when it comes to birth control due to the diversity in America. Some religions are opposed to birth control. For example, the Catholic Church opposes birth control, though according to the National Health Institute, 75% of Catholic couples practice some type of contraception. Opposition to birth control is directly associated with degree of religiosity. Some cultures may have difficulty discussing sexual and reproductive health, especially when it comes to adolescents. Gender role inequalities is another cultural component that should be considered. Awareness of different cultural views of sexuality and sexual behavior play an important role in birth control because some cultures may believe that sex is for reproduction only, not pleasure. In addition, some cultures do not believe in premarital sex, meaning that birth control for adolescents may be a difficult or taboo subject. Some cultures reject Western medicine and prefer alternative medicine. An example of this is using herbs to decrease fertility instead of birth control pills. And lastly, fertility beliefs may differ among various cultures. In conclusion, birth control improves maternal and infant health, decreases maternal and infant mortality rates, and significantly decreases teen births. There are various types of birth control that are available depending on individual needs and preferences. Birth control saves large amounts of money on a societal level. There are many ethical dilemmas associated with birth control, especially for adolescents. Birth control needs to be approached with cultural sensitivity and awareness of one's own biases. For more information, please visit Planned Parenthood's website, Center for Disease Control and Prevention website, and the World Health Organization's website.